tsiku lina tikuchokera ku Mangochi, panapezeka kuti tinali mgalimoto anthu 15, is it 19? Pa 19, 15 anayamba kusegula mimba.
The outbreak affected almost all part of the zone. Almost all the health centers were affected.
In our response, we have been focusing on wash interventions. These wash interventions are very much focused on the prevention measures because, as cholera, the contributing factor is the hygiene behavior practices, which are more focused on wash. And once you have improved areas in terms of water sanitation and hygiene, in terms of infrastructure as well as practices, behavior practices, you very much control the spread.
Oxfam has assisted quite a lot, especially in Katuli, where they were implementing the Cholera Response Project. Traditional Authority Katuli was one of the TAs that have had no interventions to do with wash at a big magnitude. The last project that was in Traditional Authority Katuli was in 2005. That was under Mangochi rural water supply. But since then, we have had no project that has come to the area to do such kind of work that Oxfam has just recently done.
The other area which we also discovered during the baseline survey was the poor access in terms of the water and sanitation and hygiene facilities. Our assessment discovered that a number of boreholes were broken down. About 45 boreholes in the area were broken down.
Mbuyomu tinali kumwa madzi kusinje. Tikachoka kumawa kumabwera cha kumasana podikilira na madzi kuti ena apeze.
So with the coming in of Oxfam, the 42 boreholes that have been repaired, we were taking out the revision 4, which is a bit costly and a bit challenging for the communities to do maintenance works on their own. So for the 42 boreholes that have been rehabilitated, I think that one will put a plus in terms of the adequate and the provision of safe water to the surrounding communities in Traditional Authority Katuli.
We have trained the water users. Every committee is a committee that is responsible. So we've built capacity of these water point committees and also how they can establish funds for repairs and also to make sure that at least they do operation and maintenance by themselves.
Fetu kuona kuti ndizofundikira kwa bwino sina ngatapeza njigo pamene atipasa jigo ndi pamene akutiuza kumangirira kwa njigo kupanga check. Choyambirira pamene atipasa jigo atiuza kuti atipasa chani zisulo zimenezo zofunika so tizikatani tizikasamala. Jigo pamene atipasa jigo ndi wathu ofunika kusamalira ndifeyo munga ena ndiye chani a committee. Ndipo so jigo aziona azipanga kuti chani service usanati kuonongeka. Ya ndi jigo pamene uzitani uzienda bwino koma usati azidikira kuti jigo uonongeke ndi pamene azitani aziyambe kumasula. Ndi program iyi atitengera kuti tiphuze kutani kumasula kwa jigo ndi kumanga.
On the same, we also have done the community-based water quality monitoring. What we've done is we have built capacity for the water technicians, extension workers, to be doing the water monitoring by themselves. Using the Dilagwa kit, they are able to quantify type of colonies, type of bacteria that has been found in the water.
Koma papa pamene tikumwasono madzi apa njigo sitikumva kanthu kena kalikonse kosatira kafungo komveka kena kalikonse.
We have rehabilitated a water system at Katuli Health Centre. The project was targeting Katuli Health Centre and Luwalika Health Facility catchment areas. We conducted technical assessment just to understand the status of the water systems in these areas. In Katuli Health Centre, what was happening, they have had a system quite all right, but it was not functioning very well, almost like dilapidated, because the water was not running in the system, in the clinic. Oxfam had to purchase all the materials that were required and utilize the same crew from the maintenance unit at the district level. So that's how we did. But it was a major project because of the pipeline. Previously it was a galvanized pipes which were getting rusty. So we had to replace them with a new type of pipes that do not rust.
Now, because we have the running water, it's easy for us to fight against the transmission of the diseases, including the diarrhea diseases, which includes also cholera, which has been a challenge to us, as we know that Malawi was hit by this outbreak of cholera.
And thirdly, in terms of the interventions around the gender-based violences, we've also built capacity to volunteers. There are social protection, child protection committees in the communities.
Kuno kwathu kwitunji pagulu limeneli ndi ntchito imene tikugwira kwambiri timafikira anthu amene ali ndi madando osiyanasiyana makamaka azimayi kapena azibambo.
Mostly we know that it is women who take care of the sick. So mostly it burdens the women in the society, in the community, to look after the sick. So their daily schedule is overburdened with taking care of the sick.
Kungoya makhala wowauza umoyo watanzi kabano umoyo wangwiro osadwala abange chani muntu aliyese bakumbaga abange bwanji kuti akhale ndi moyo wabwino. Izo ndizimene timona kuti zimalumikizana pakati pa matenda akolerawa kwa anthu komanso zankhanza kwa anthu.
We have been satisfied with the response Oxfam has brought in to fight against cholera in Katuli and Luwalika, in fighting against cholera and also reducing or mitigating vulnerabilities that are brought in with GBV that comes in with cholera. For example, within the communities, we instituted CBRM squad meet which respond to GBV issues that arise. We also instituted within these CBRM committees where there were complaint box put in place and the people were trained in case management and they know how to handle the case when it's been referred to them and where to refer it if it's beyond them. So we've made some strides in fighting against GBV within this community, and the communities are eager as well to continue with whatever they've been trained, even when Oxfam is not there.
We are supposed to provide to the beneficiaries wash non-food items, which contain like buckets, soap, and other items. So what we did, we had to conduct a need assessment in terms of what are the items, commodities that are available within the community, and what are the things that we are supposed to provide to the community, the beneficiaries in the project, which would not be available. So we conducted the assessment. We discovered that the buckets, soap, and small items were available within the community. And the vendors were also willing. We had to find out from the vendors if they were willing to supply.
Atatipasa mwayi umene tinaona kuti ndi chinthu chapamwamba chifukwa kunoko kwakhala kukubwera mabungwe ambirimbiri. Komano atazatiuza kuti tikufuna mupange supply katundu oti titandize anthu amene akuzidwa ndi za cholera kuno kwa Katuli. Ndiye ifeyo tangobwera mmene tabwerera koma china chilichonse tifuna tione kuti ngati anthu akudera lino mungate kukwanisa china chilichonse chakwa Katuli apindule achaine ake anthu akwa Katuli konkono. Tinaona kuti ndi chinthu cha nzeru akutipasa business imeneyo ndi business. Ndipo pano pa ife ngati anthu akwa Katuli amene tinatenga nawo mbali pa business imene iyi ndife otokoza chifukwa tatukula ma business yathu mabizinesi athu anali ang'ono koma pano pakuchokera pa nthawi imene anatipasa business imene ya Oxfam kufikira lero mabizinesi athu atukukako ndithu apita chisogolo.